Hi, my name is Kelly Colonello. I'm a nurse practitioner in gynecologic oncology. I've been doing this over 30 years. It's a passion of mine. I've always felt like women's healthcare maybe was a little underserved, so I decided to go into women's healthcare, and actually my degree is in women's health. And I've always had an interest in oncology just because oncology is very difficult. Taking someone from their diagnosis through surgery and chemotherapy has just been a real strong interest to me, and that's why I pursued this career. In gynecologic oncology, Dr. Scribner, the surgeon that I work with, does minimally invasive surgery, which is robotic laparoscopic surgery, which reduces the recovery time greatly. Women actually with cancers can have robotic laparoscopic surgery and actually go home the same day. We diagnose and treat all women's cancers, such as cervical cancer, endometrial cancer, vulvar cancer, and vaginal cancer. Most common conditions, female cancers, are definitely endometrial cancer. One of the warning signs of endometrial cancer is postmenopausal bleeding. So I feel it's very important to educate women about their bodies and what signs and symptoms to be aware of. I would describe it as a holistic approach. I believe in treating the whole person and not just a disease. I believe in treating mental health as well as physical health. We do encourage that patients bring their family and support as well. I like to talk to my patients and get them involved as far as asking them questions. I like to ask the patient what they interpret as their disease and try and help them understand without using a lot of medical terms. First, we introduce ourselves and let them know what we do. We try and involve our patients as far as their care and their input. We like to describe the disease process, signs and symptoms. When I do chemotherapy teaching, I use a lot of tools as far as handouts. We give comfort bags that patients can take for chemotherapy. I think it's just very important to involve each patient to a great degree so that they feel like they have a voice in their care. I think to make the most of at least the first appointment, it's important to have questions for the providers. And also I would encourage patients to bring their spouses, support people, and even children to the appointment so that we can discuss it as a family.